China, which is very consequential and very important. That is the Healthy China 2030 plan. Now, October last year, China launched its first 15-year strategic plan. So we are. This is the first year of implementing that plan. Now, as someone who has been closely involved in developing that strategic plan, I can honestly tell you that we took a lot of inspiration from the Healthy People Exercise initiative in this country. That, of course, has been a 10-yearly plan since 1979. Now, both of these strategic plans, you see the difference to me between a manager and a leader is a leader is somewhere, not rather than reactive, it's proactive, so looking into the future with a vision. Now, if you develop a strategic plan as a leader, you have to take into account the major changes as well as opportunities brought about by the mega trends. Now, there are many studies about the question, what are the mega trends which are most important forces that will help shape the future world? But I think we would agree the 4 mega trends or major global changes that are among the fundamental, we have to take them into account when we do the future planning. Urbanization, aging, changing lifestyle, and technology changes. And all those changes, of course, will lead to rising non-communicable diseases, as well as rising demand for better more healthcare services, and that, of course, has led to cost escalation in many countries, which in turn have very important implications for our policy discussions, strategy discussions. How can we reform the healthcare system in reaction to those changes, and how can we take a more proactive approach to do the health promotion, prevention, and so on and so forth. So we know that worldwide 1.5 million people were added to the global urban population every week, but more or less the urbanization on the global scale happens surely but slowly. But in China, the urbanization really takes place in the last decade or two, not only surely, but very, very rapidly. Yeah. So that has tremendous impact on the resource streams and infrastructure building. Now, to complicate the urbanization process is China's recent slowing down of economic growth. That's also part of the worldwide economic slowing down. And after having experienced double-digit growth for decades, so the downward economic growth pressure also had a tremendous impact on the policymakers in China when they think about future strategies. Now, aging, which is a topic Bill just covered, China probably is the first country in the history of mankind that where the aging takes place. It becomes a rapidly aging society before becoming rich. The transition, over 10% of the population who are 65 and over, for Europe and other countries take 70 years, 100 years. China only 27 years. So today we have about 168 million people who are 65 and older, and that proportion of the population is rising even faster. Now, years ago, The Economist magazine had covered the worldwide obesity epidemic, and that is, of course, very true in China. Both the obesity and overweight among children and adults is still on the rise. Now, there are a lot of technology advances, which represent both challenges as well as exciting opportunities, human genome, and so on and so forth. But I think the information technology is the one which represents a lot of potential for us to think about the future strategies. And by 2020, it is estimated that there will be close to 7 times the number of connected devices as people on the planet. Now, already today, China has almost for every citizen in China, you have a cell phone, you have a smartphone. Yeah. So that information age, whenever we talk about future healthcare strategies, the IT must be featured prominently. We are very fortunate to have David Blumenthal, the former national health IT coordinator for President Obama, who will give a talk later today. Now, we know that